I'm Sarah Gordon. I'm an osteopath from Harrogate, and
I'm John Brewster, an osteopath from Keighley.
we were going to talk about what to do if you need to, if you have a joint that's inflamed and it's painful and you want to try hot and cold therapy to help reduce that.
Yep. You go first.
Okay, so basically I often say to my patients, one thing that can work if you've got an acute painful back or knee or anywhere else is to try hot and cold therapy to help reduce inflammation in an area. So I suggest that you use a cold pack, which I do actually sell at my practice. I think you can get them online as well. This one has been in the freezer, but the thing about these gel packs is they stay mobile even when they're freezing cold. If you don't have one of these, you could use a bag of frozen peas or a bag of sweet corn or even a bag of ice cubes just in a plastic bag. And then you alternate this cold pack with a hot water bottle or a wheat bag or a cherry pack or something, cherry seed pack, cherry stone pack. So what you would do, so that you don't get a freeze burn on your skin, is you get your ice pack, wrap it in a tea towel, and then you can put that onto the sore joint. So if it was my low back that was sore, I literally would shove it down the back of my trousers and then sit down or lie down with it on the area for about 5 minutes until the skin got really cold and the area underneath was all cold. Again, I could put it on, say if it was John's knee, you could put it over your knee and have the same effect. So you do about 5 minutes with a cold pack, then about 5 minutes with a hot water bottle in the same way, then keep alternating, and ideally you do say 3 or 4 hot sessions in between the cold. So start cold, end cold, with the hot packs in between.
So it works by basically increasing the circulation, so you get the vasodilation, vasoconstriction, the two elements combining. So you get like a pump action, bringing in the good stuff, washing away the gunk. As simple as that really. Increasing the circulation and controlling inflammation. And then combined with that, you can then get some anti-inflammatory gel after you've done the contrast bathing. And once you've got the circulation increased, then you're going to apply the gel or the spray to the affected area and work it well into the joint. Using on the joints more successfully on the joints near the surface, such as knee, ankle, elbow, wrist. Not quite as successful on the joints which are further away from the skin, shoulder and back, but they're worthwhile to try to help control inflammation as well. So you follow that on after the contrast bathing. Then you can use the homeopathic remedies, such as arnica. Is the one for like a catalyst. It works as a catalyst for trauma. You've also got rust tox and rue de grave, which work on a deeper level in the same catalytic effect to improve the rate of recovery. And the way to do that, you just put the little tablets, dispense them into the cap at the top, and you pop them in your mouth and they dissolve in your mouth. You can crunch them, but as long as they stay in your mouth for as short as long as you want, they'll have their effect from the inside out. So in summary, you have those working from the outside in, the contrast bathing for start and finish with cold, 5 minutes with each one to increase the circulation. Then you've got the anti-inflammatory gel to work alongside that from the outside in to get into the joint to again control inflammation, followed by the homeopathic from the inside out to control and help aid the inflammatory response to that trauma.
And one thing I would say is that you could do the hot and cold 3 or 4 times a day, or you could do it all day long. So if you're really injured and you really, you're in a lot of pain, you want to get rid of it quickly, you just keep doing cold and hot as much as possible. Look, we've got a little.
And then you've got also the places to get these from is you've got obviously contrast bathing you can do at home. You get those in from the freezer and from the hot tap. The anti-inflammatory gel you get from a chemist, they're all much the same. Ibugel or Voltrol, everybody has their own preference. And the homeopathic stuff you can get online at the Helios Pharmacy or from Boots the Chemist.
Okay, so that's how you do hot and cold. Thank you.